Hi, I'm Michelle Ulrich, and I am a dietitian at Sharp Memorial Hospital. I have my master's in nutrition sciences, and I'm also a certified nutrition support clinician. Notice the MSRD Cnsc after my name. So for me, a typical day is probably from 8 to 4:30, Monday through Friday, although the hospital does not close, so I do work some weekends as well as holidays, and then we'll be on call every couple weeks on the weekend. At Sharp Memorial Hospital, there's about 12 dietitians ranging from full-time, part-time, and per diem as well. For me, in the ICU, there's usually 2 of us dietitians per day covering a surgical intensive care unit and a medical intensive care unit. But first, before I get into what I do daily, I want to talk a little bit about how my day goes. I'll usually arrive into the hospital, like I said, around 8 o'clock, maybe glance at email for a couple minutes, which is very different from a lot of other careers these days, and then, set up the list of patients that I will see for the day, and that can range from, 10 to 13 patients per day. And then the rest of my day is with the patients, taking care of them and nutritionally. Some other things that I might do throughout the week, not always daily, is attend different meetings, or we do a lot of patient rounding. For example, in our surgical intensive care unit, we have a trauma department, and they actually round every day at 9 a.m. I also am a part of our nutrition support team, which will round twice a week. And then our medical intensive care unit will round weekly. So a lot of patient care as well as interdisciplinary patient rounding. I'll also be involved in some research projects, different studies, and some other projects on the side that you kind of fit into your day and your week. Now, some of my responsibilities are nutritionally assessing a patient, seeing how well-nourished or not nourished a patient might be, and coming up with a plan of care for them, as well as reassessing patients and doing follow-ups. A lot of times we'll see patients every other day or even daily in the ICU. Some of the patients that I might see are, a patient that's at risk from malnutrition, any patient with, skin issues, pressure ulcers. I see all of our trauma patients. Different diagnoses might flag a dietitian to see. Doctors can consult the dietitian. Anyone who hasn't eaten in a few days will assess to see maybe what their nutrition plan of care is. And different diet orders where, a dietitian might need to intervene and help them during their hospital stay. Another interesting part of my job is I also sit on the heart transplant and LVAD committee, where we review different patients with heart failure and if they are appropriate for a left ventricular assist device, which is the LVAD, or a heart transplant. So let's talk a little bit about the 2 units, the surgical intensive care unit and the medical intensive care unit. Really, at Sharp Memorial Hospital, we have the 2 ICUs, all adult patients. The surgical intensive care unit, you'll see your trauma patient, you'll see cardiac patients, and then you'll see your general surgery patients. In the medical intensive care unit, you'll have your respiratory, pulmonary patients, as well as other medical issues. And I would say a lot of times in ICU, you're going to walk through those units. If you've ever walked through one yourself, you'll see a lot of different drips hanging, a lot of equipment in the rooms. I would say the majority of our patients are on a ventilator. Not a lot of people eating, so we do a lot of nutrition support, which is your enteral or parenteral nutrition, your tube feeding or IV nutrition. So to talk a little bit about how I got to where I am today as a registered dietitian, I actually have an undergrad degree Bachelor of Arts degree in Communications, Radio, TV, Film from Rowan University, which is on the East Coast in New Jersey, where I'm from, where I also played on the collegiate women's basketball team. I worked in Philadelphia and New York City for probably 3 or 4 years, kind of in the TV industry, and just realized that that's not what I wanted to do. I just didn't have the passion for it. And kind of during that time, I was transitioning from a collegiate athlete into what do I do now, and started running marathons and doing different endurance events. Started reading a lot about sports nutrition. I think that's kind of what sparked my interest in nutrition. Who would have thought that I'd end up in critical care, but that's where I did, and that's where I ultimately found my passion for nutrition. So then from there, I ended up moving cross country and attending San Diego State, where I got my master's in nutritional sciences, as well as the undergrad didactic program in dietetics. So I took all the undergrad nutrition courses that I needed. To become a dietitian, you also need to do an 8-month internship program. Very competitive, and I ended up getting a distance program through Utah State. So I was lucky enough to set up all my rotations here in San Diego through various facilities and entities. Within the internship, you focus on food service and child nutrition education, community nutrition, so did some stuff at WIC and other nutrition programs, and then also a clinical rotation, which included inpatient, outpatient, and long-term care settings. I actually rotated through Sharp Memorial, where I work now. And then after all that was done, you sit for the registered dietitian exam. And that was about 4 years ago, and I've been working at Sharp ever since then. I also recently, about a year ago, this October, I became certified in nutrition support, and that's where the Cnsc comes into play. So specializing in enteral and parenteral tube feeding and IV nutrition. So my current position as a critical care dietitian is kind of where I see my future. I was very, very lucky to have a fabulous mentor while I was going through school, as well as during my internship, and then now currently at Sharp Memorial Hospital, who has kind of guided me and pushed me to be what I am and to get into critical care in this challenging position that I have just loved every second of. So some of the skills and qualities that you would look for in a critical care dietitian, time management, putting in the work. You have to put in the work, and I think I learned those skills as a collegiate athlete. Teamwork is a big thing. You're working with doctors and nurses and your dietitian colleagues. A lot of the skills you develop as your life goes along, like people skills. People skills are very, very important because you are working with so many different types of people, as well as personalities and patients as well. Critical thinking skills are invaluable. No day is alike. No patient is the same. I can't even say how important critical thinking skills are. You need to be focused and driven, and those are big qualities for a good dietitian. And just be willing to learn all the time. Every day you're learning, and you just want to have that passion to just keep learning and do the best job that you can. At least that's how I feel about my current position. So some of the favorite things about my job and my career right now is working with my colleagues and the other interdisciplinary team members. I love the fact that my job is super challenging. The days fly by. I get in at 8 and all of a sudden it's 4:30, and where did the week go? I love that I'm constantly learning. There's not a day that goes by that I'm not learning, or I'm not reading something new and applying it to my job. And I love the fact that I go into work every day looking forward to it and feeling that passion that I started off with 4 years ago at my current job. Some of the limitations are, or maybe my least favorite things, which there are not many, but just a limitation in practice. So, for example, dietitians need a lot of orders from the doctors. We can't order multivitamins without an order from the doctor. We can't even order the tube feedings or IV nutrition without an order from the doctor. So I would say and even nutritional supplements. So I would say that's a big limitation. Also, we're very evidence-based practice driven, but there's a lot of evidence gaps. It's really hard to do research in critical care. We have the sickest of the sick patients. It's hard to get a control group. You can't not feed one person and then feed the other and see what the outcome is. So, kind of to wrap it up, some of my tips for success is, take this time in school and find out what you're passionate about. Take in those things that you love and take in those things that you also don't like. Don't be scared to make changes and realize that what you're doing might not be the right thing, so keep looking and keep trying. Ask a lot of questions. There's never a dumb question. Don't be afraid or embarrassed to ask a question. Learn as much as you can. Take advantage of all the people you're surrounded by now, your classmates, your teachers, anyone you might meet in your field. Just pick their brain. Join, local organizations. If you're interested in nutrition, join the Academy of Nutrition and Dietetics, as well as their local San Diego chapter. Read whatever you can. Keep learning. Attend conferences. If you're interested again in nutrition, join SNO here at San Diego State. But just make sure that you find the thing that you love and go after it. So I think that's it. And good luck with your career searching and the rest of your schooling.